The honourable member for Calgary-Elbow.
Thank you very much, Mr. Speaker. The number of people with dementia in our province will triple in the next 30 years, and that's why I've been asking this government repeatedly about their dementia strategy, or should I say their lack of a dementia strategy. And so, frustrating as it is, I will ask today for the third time. In June, the Minister of Health promised the strategy would be completed in a couple of weeks. In September, she said it's coming soon. But Albertans are still waiting, Mr. Speaker. To the Minister of Health one more time, where's the dementia strategy? When will we see it? Why is it taking so long?
The Honourable Minister of Health.
Thank you very much, Mr. Speaker, and to the member for the important question. This absolutely has been a priority, and we every time we feel like it's almost done, it kind of reminds me of when I was working on my master's thesis. We always think there's one more thing that we can just improve a little bit to make it that much better. We're doing this in partnership with a number of stakeholders, Mr. Speaker, but it will be done very soon. I dare to give an exact date, but I'm hoping to have it out before Christmas, Mr. Speaker.
First supplemental.
Thank you, Mr. Speaker. Now, given this government has started sending signals that cuts are coming to education and PSE, we can only assume that healthcare is next. And given there are many community programs that are cost-effective and deliver badly needed services to people with dementia, their families and caregivers, and given these programs save money by keeping people in community rather than hospital, again to the Minister of Health, will you commit to not cutting any existing dementia support programs in the next budget?
The Honourable Minister.
Thank you, Mr. Speaker, and to the member for the important question. I think that our past budget practices have shown that on this side of the House we stand with Albertans. We're working hard to protect and improve health and education. The calls for cuts continue to come from the members opposite, Mr. Speaker. We're working to make sure that we can move forward in a way that's respectful of all Albertans, including those who are living with dementia and their families, Mr. Speaker.
Second supplemental.
That's not a no, Mr. Speaker, and you're not hearing calls for cuts from me. Mr. Speaker, dementia care in this province doesn't just need sustainable funding for existing programs. New investments are badly needed. Given that Ontario has a fully funded provincial dementia strategy, and given this strategy allocates $100 million over 3 years, plus an additional $20 million for respite care, one more time to the Minister of Health. If we do eventually see a provincial dementia strategy, and I sincerely hope that we do, will it come with significant new funding to support Albertans living with dementia, their families, and caregivers?
The Honourable Minister.
Thank you again to the member for the question and Mr. Speaker for the opportunity to respond. We continue to work forward with the dementia strategy itself, which will hopefully be released in the coming days. And Mr. Speaker, the budget process, the budget cycle begins, of course, in the spring. We look forward to bringing a budget to this House. We know that the official opposition has talked about cuts of 20%, Mr. Speaker. We know that wouldn't help Albertans. We're fighting hard to make sure that we improve opportunities for Albertans to get care in the communities that they choose to live in, Mr. Speaker, and that, of course, includes dementia supports.